Hello everyone, welcome to From London with Love with me, Lynn Clive on ALB UK TV. Today we are going to talk about menopause and we are joined by the gynecologist Dr. Nadia Yousri. Hello doctor.
Hello, hi Lynn, how are you?
Thanks for being with me today.
It's a pleasure to be here with you.
I would love you to introduce yourself to the audience, please.
I'm an obs and gynae surgeon and a fellow of the Royal College of Obstetricians and Gynecologists, and I work in NHS University Hospital, and I'm very proud of that.
Can you explain what menopause is, please?
The definition of menopause is cessation, stoppage of the period, regular cyclical changes in the womb, at least for 1 year, complete stoppage. This is due to the declining of the estrogen hormone, which is the feminine hormone. So the function of pregnancy stopping. But there is a problem with the decline of estrogen, because estrogen is a hormone that affects every cell in the body of a lady, from top to toe. So with the declining of estrogen, there are general symptoms of menopause like mood swings, hot flushes, night sweats, mind cloudiness, forgetfulness, and all these things. And of course, other deep medical problems like osteoporosis, heart problems, and later on there is Alzheimer's disease, related to the declining of estrogen. So this is really, and beside that, I talked about the local effect of declining estrogen on the feminine area. So even the reproductive organs, of course, becomes atrophied or shrunk, and outside as well. So you'll find very annoying symptoms that really more important than the general symptoms that bring the lady to the gynecologist, like vaginal dryness, urinary leakage of urine, sense of looseness or laxity in the tissues below, disorient or actually sagging of the tissues, not nice appearance outside. That all these things subsequently, and by the lady would feel that low self-esteem generally, and loss of confidence. And if you have a lady who feels that she's not really beautiful, she doesn't feel beautiful or confident, this will impact or reflect on her family life and relationship, of course.
Now, how can women cope with the emotional symptoms?
It's very difficult, because the effect of declining estrogen on the brain is really causing, as I said, mood swings and depression, bouts of depression. And the actual effect that seeing the changes in her body, it really exaggerates or accentuates the problems. So in my opinion, that if you want to improve the emotional or the mental status of a menopausal lady, is to attack the cause. Reverse, if you can, the menopausal symptoms and menopausal effect. So that's what they do. They try to search or seek to have hormone replacement therapy for the general symptoms, because sometimes you find high-profile ladies can't function because of mood swings or whatever. So a little bit of dose of replacement therapy can help. And topically or in the feminine area, it's a big deal for vaginal dryness, etc., etc. So they seek help through the having hormonal, topical estrogen hormone that really helps temporarily, but once you stop the course, things back again.
Okay.
So because you didn't really provide an ultimate or a core treatment for it. So that's what I'm here because we need to tell the ladies not only that there are a new category or subspecialty of the gynecology called the aesthetic gynecology, which is misnomer, it's not aesthetic. It's coming from aesthesia, the word aesthesia, which is sensation, discipline. So it means function. So these are non-surgical procedures that help stimulate the body to regenerate the tissues completely. So imagine area really shrunk and the tissue shrunk and blood flow is less. So you're trying to reverse these things by getting more blood flow, getting the builder cells to like redecorate the area, renovate the area, if I can say.
Yeah.
So it's like being youthful, usefulness, bringing youthfulness again. So that's the ultimate treatment. That's what you need.
Yeah.
So you find problems like vaginal dryness disappear without any hormonal treatment. You'll find mild up to moderate even cases of urinary incontinence improved because you improve the supporting muscle in the urine tube. Whether due to, there are various, of course, non-surgical procedures, including machines. And they are more of safe if you are, they are operated by gynecologists, of course, to adjust the energy, etc., so avoid complications and risks. But I can tell you that the results are very effective. Like vaginal laxity, which the ultimate treatment in NHS was just surgery. That's the ultimate. Anything else like Kegel's exercises, hormonal cream, not really useful as such. It's not improving, but not such to make a difference. But surgery is the ultimate treatment. But not all ladies are suitable for surgery or want surgery.
Definitely.
Plus the risks of surgery.
Yeah.
So these non-surgical procedures, aesthetic procedure or functional gynecology, have got results as equal as surgery. I can tell you.
Can you give them more tips of lifestyle changes, maybe?
Lifestyle changes help, but again, for example, diet and exercise improving the general symptoms of menopause and the sense of well-being and the confidence. But we need something to help that to support the tissues because of the declining estrogen hormone. The only treatment is either to replace the hormones, which helps in general symptoms, but it has to have, even if a lady takes hormone replacement therapy, it doesn't reach the feminine area in a dose effective enough to reverse the changes there. Like osteoporosis, you need to have a certain dose limit of hormone replacement therapy to reverse the changes of osteoporosis. So even the hormone replacement therapy is dose effect. So for certain tissues. Yes, lifestyle is helpful because it adjusts the mood.
Yeah.
And plus improves the physical power or sense of physical function of all the structures, internal and external, and the muscle volume, etc. So, of course, gives her some independence and a sense of well-being, of course, yeah.
And what advice do you have for women who feel anxious or uncertain about the changes who are watching us today?
Uncertain. You are absolutely right. Some ladies, they are just indulgent in their career and they faced with the premenopausal periods and they start to see changes in their body. So as you mentioned, if they are not aware that this period of life is inevitable, will come sooner or later at certain age, which is 52 in UK. That's the average age. And they have to be prepared, as you said. So prepared by lifestyle, prepared by that. They have achieved something. So it's not all about vanity. No, they have self-esteem that they are achievers in some way, either family or in career, etc. Plus taking care of their lifestyle and seek to address the problem of menopause. What symptoms, the problem they can improve. For example, the new things is non-surgical procedures. Let's go and try. So that's the way, knowing that there are solutions for the problems they might face helps a lot. Help a lot.
Yeah. Thank you so much, Dr. Nadia. Thanks for your time and thanks for all the information you gave us today.
You're more than welcome.
She's a big supporter of all the topics we raise in From London with Love. Thank you so much for being with
You're
me
more
today.
than welcome, Lian.
Thank you.
Always. Thank you.